Welcome. Today we're here to go over safe lifting and transferring practices. Back injuries are the most common work injuries among healthcare workers. Here are some tips to remember when doing any lifting. You must first understand body mechanics. Body mechanics is the way in which we position our bodies during tasks. Now we're going to show you the effect on your lower back when you lift a 10-pound object improperly. If you bend at the waist or slouch while lifting, it takes much more force to lift the same object. When your shoulders are positioned in front of your pelvis, it puts a tremendous strain on your back. Lifting a 10-pound object improperly puts 100 pounds of pressure on your lower back. With years of improper lifting practices, wear and tear on your back can turn into chronic pain. Now that you've heard about the importance of body mechanics while lifting, we're going to show you the proper way to implement safe lifting techniques in order to keep your back healthy. Proper body mechanics is when your head is aligned over your shoulders and your shoulders are aligned over your pelvis. Please stand and follow along to practice proper stance. Take a balanced stance, feet shoulder width apart. Do not bend at the waist. Bend your legs, keeping your back straight. Get as close to the object as you can by bringing it towards you or moving in front of it. Get a secure grip. Lift gradually using your legs, keeping the object close to you. Change directions by pointing your feet and turning your whole body. Please use these tips when doing any lifting. Now that you've learned the proper lifting techniques, these should also be used while transferring residents. Some residents need assistance in transferring from one surface to another. As you assist a resident to transfer, you must keep in mind the safety of the resident and the safety of your back. Here are some tips to remember every time you transfer a resident. Assess the lift. Ask yourself if you can lift and transfer the resident alone. Can the resident bear weight? Is the resident cooperative? How much can the resident assist you in the transfer? Once you determine your ability to safely transfer the resident, continue with the one-person transfer or get help. Never try to transfer someone by yourself that you are unsure of. Now you are ready to start the one-person lift and transfer. Tell the resident what you are going to do and how you're going to do it. For example, you might say, "Marge, it's time for lunch. We're about to assist you to stand." Prepare the environment for the transfer. This might look like clearing obstacles that hinder safe movement, having all the equipment placed and ready, for example, walkers, wheelchairs. Apply the gait belt. Every lift requires a gait belt. Always face the resident being lifted, whether that is in front or on the side of them. Make sure the resident places their hands on the arms of the chair. Move the resident toward you, not away from you, scooting to the edge of their chair. Have them lean their head forward, nose over toes. Holding on to the gait belt with both hands, gradually lift the resident to a standing position. If you must turn, pick up your feet and pivot your whole body in the direction you're going. Keep the resident you are lifting close to your body. Lastly, make sure they are secure with their walker or other assisting device. Remove gait belt after ambulation. Hi, Marge.
Hi.
It's time for lunch.
Oh, good.
Are you ready to go?
Yes, I am.
All right, I'd like to help you with your transfer.
All right.
You feeling strong enough to transfer?
Yes.
Okay, I'll give you a hand. Let me grab your walker.
Cool.
We'll move your coffee so I don't knock it over. I'd like to have you scoot to the front of your chair just a little bit. Okay. Now I'm going to put your gait belt on. All right. Okay. You want to bend forward, and on the count of 3 we'll stand. 1, 2, 3. There you go. All right, off to lunch. Next, we're going to talk about a two-person resident transfer. Assess the lift. Ask yourself if you can lift and transfer the resident with 1 or 2 people. Can you lift without a mechanical device? Can the resident bear weight? How much can the resident assist in the transfer? Once you determine your ability to safely transfer the resident, you can 1. Continue with the 2-person transfer, or 2. Get a mechanical device. Never try to transfer someone that you are unsure of. Now you are ready to start the 2-person transfer. Tell the resident what you are going to do and how you are going to do it. Prepare the environment for the transfer. Clear all the obstacles that may hinder safe movement. Have any and all equipment placed and ready in this scenario. Make sure the wheelchair brakes are on. Apply the gait belt. Remember to always use a gait belt. Position each person in front of the resident, near each of the resident's sides. Both people should be facing the resident being lifted. Move the resident towards you, not away from you, scooting the resident to the edge of the chair with their hands on the arms of the chair. Lift on 3. 1, 2, 3. Hold on to the gait belt and gradually lift the resident. Both helpers pivot the resident so their back is to the wheelchair. Do not twist your body. Gradually lower the resident into their wheelchair and remove the gait belt. Hi, Marge.
Hi.
How are you?
Well,
Hi, it's supper time. Are you ready to go to supper?
well, I'm feeling a little bit weak.
Okay, well, I was going to help you with the transfer. You want me to get some assistance with your transfer?
Might be.
All right, let me call for Nyla and see if we can get some assistance. Nyla, can I have some assistance in F2 with the transfer, please?
Hi.
Hi, Nyla. All right, well, let's get some help here. If you can scoot forward, thank you. We'll put the gait belt on. Let me get your wheelchair ready. You stay right there for me. All right, we're gonna have you scoot forward a little bit. And let's put your hands on the chair. Count of 3. 1, 2, 3. And we're just going to dance over to the chair. There. Take your belt off. There we go. Off to dinner we go. Finally, I'm going to talk about the camel. Use the camel every time a resident has fallen. After the shift supervisor has assessed the resident for injury and it is determined that it is safe for them to be assisted from the floor, you will need to use the camel. Never attempt to lift a resident who has fallen to the floor and cannot get up by themselves. You must know where the camel is stored at your house. First, make sure you have 2 people to use the camel to lift the resident that has fallen, 1 person on each side of the camel at all times. Remove the camel from the carrying bag, unfasten the straps, and unroll it onto the floor next to the resident. Position the camel at the side of the resident so that the resident's head is level with the camel badge on the head of the rest. Place the cordless compressor out of the way. Make sure it is charged by pressing the battery button that is indicated how much life is left. Connect the 4 hoses from the hand control to the corresponding numbered and colored connectors that are labeled under the camel headrest. There is a plug on each layer. The hoses need to click into place to be fully connected. Connect the white tipped hose from the hand control to the compressor. Ensure that the hoses are not kinked or the camel will not inflate. Roll the resident onto the green slide sheet that is found in the camel bag. Using the slide sheet, slide the resident onto the camel. Make sure to remove the green slide sheet before inflating the camel to reduce slip. The resident's head should lie on the camel badge and their body should lie centrally, feet on the floor. To switch the compressor on, press the power button. The green light will come on and will stay on while power is selected. Press the number 1 button on the hand control to partially inflate the backrest section until the resident is in a comfortable position. Press the number 2 button on the hand control to inflate the bottom section until it becomes rigid. Continue to press buttons 3 and 4 in sequence until the sections become rigid in exactly the same manner. Press button 1 to finish inflating the backrest and arrive at a sitting position. Make sure there is an aid on each side of the resident while fully inflated because of fall risk. The resident should now be in a position to stand or transfer. To de-inflate the camel, unplug each hose from their corresponding numbers. Roll the camel back up, place the camel back where you got it, and plug the compressor back in to recharge. Remember to use these lifting and transferring practices, not only for yourself and for your back, but for your residents' safety.
Hi, we're here with Dynamics Physical Therapy today. We're talking about proper use of equipment and sizing for assistive devices. So first, let's go ahead and take a look at proper use of a cane and how to size it. And here's a video to properly demonstrate it.
If you have a weakness that's greater on one side of your body, you will want to hold the cane on the opposite side. Or if you have general weakness or your balance is a little off, you can hold the cane in either hand. Here I am demonstrating how to use the cane for someone who has left-sided weakness. In this case, you want to place the cane on the right side and have it hit the ground the same time your left foot strikes. When sizing the cane, you want to place it about 6 inches in front of your foot and slightly to the side. Then, once you're standing holding onto the cane, examine the angle of the elbow. Ideally, you are looking for about 20 to 30 degrees of a bend in the elbow. In the same position, you should check that the handle is about the same height as the patient's hip bone. As you can see, this cane is too short for this patient because his elbow is extended almost perfectly straight and the handle was below his hip bone. Let's go ahead and resize it and see how it should fit. Yes, much better. Now the patient has a comfortable 20 to 30 degree bend in their elbow and the hip bone is the same height as the handle.
Set up a cane and walk with one. Now let's take a look at using a walker.
2 ways to assess proper height with a patient standing in the walker. The first is to have them standing and check that the handle falls by their hip bone. Secondly, you can have them stand with their hands relaxed by their side. Their wrist bone should be about the same height as the handle of the walker. Again, looking for that 20 to 30 degree bend in their elbow. Let's go ahead and see how this walker fits this gentleman. So right away we can see that his hip bone is far above the handle. Also looking at his elbow is almost entirely straight. This is actually very common for us to see with our patients, is patients' walkers being too low. This can cause other pain-related issues and is a safety concern. So let's go ahead and adjust the walker and see how it can fit the patient. Yes, much better. Now we can see that the 20 to 30 degree bend in the patient's elbow. When his arms are relaxed by his side, we can also see that his wrist is the same height as the handle. All right, let's go for a walk. And away we go. Notice how tall the patient is able to stand and walk upright when the walker is sized appropriately.
Okay, now we're going to move on to a wheelchair assessment to make sure that the wheelchair fits the patient properly and that you're able to maneuver around the house. It's really important for patient safety, mobility, and comfort. So here's a quick video for a wheelchair assessment.
When sizing a wheelchair, a therapist will make sure there's 2 to 3 fingers between the patient's torso and the side of the wheelchair, as well as their hips, and 2 to 3 fingers behind the knee. This is to ensure that there is no skin breakdown or pressure ulcer development. When it comes to doorways, the ADA requires a 32-inch width minimum for wheelchair access through a doorway. 36 inches is more ideal because the patient will be able to wheel themselves through the door. With 32 inches, the patient will either need to be assisted and pushed through the door, or if they are able to, they can reach through and pull themselves through. As you can see here, my patient's door was 32 inches and she has to pull her arms in while I push her through.
Our last clip of today, we'll go over crutches, how to walk with them properly, and how to size them according to the patient's height.
To size crutches, stand and have the crutches about 6 inches in front and slightly to the sides. You should have at least 2 fingers between the top of your crutch and your armpit. You should also have a slight bend in your elbow, again looking for that 20 to 30 degree bend. Also important when standing up with crutches, to have them on one side, usually your side of your injured or weak side. Stand up, find your balance, and then place one on the other side. Okay, and a quick assessment with the patient standing, 2 fingers from the top of the crutch to the armpit. Looking at that elbow, there's a slight bend, 20 to 30 degrees. All right, and away we go.
Us here at Dynamics today. I hope you found these videos helpful. Please feel free to comment below if you have any concerns or any ideas for future videos that you would like to see. I hope you enjoy the rest of your day. Thank you.
Welcome to Herndon Harbor Adult Day Healthcare Center, and my name is Leah Frage. I'm the director here, and we'll be talking today about falls prevention. Falls are not a normal part of aging, and the literature shows that after age of 65, 1 in 4 Americans fall, and also every 11 seconds, a person is treated in the emergency rooms for fall. So falls are really a major concern for older people. And one of the contributing factors is aging. We know that as people age, their risk of falling increases proportionately. And there are reasons for that. First of all, as people get older, their muscle mass and muscle density decreases. For men, the literature shows that after the age of 30, every 10 years, their muscle mass decreases anywhere between 3 to 5%, which is a lot. For women, they're at increased risk of losing their bone mass after menopause. And with aging, people's muscles start to become stiffer, their joints also become stiffer, and they lose their flexibility and their ability to right themselves as they're falling. Okay, that reflex reaction slows down, which increases their risk of falling. And for people with dementia, the literature shows that their risk of falls increases by 8 times, a factor of 8. And because they already are prone to losing their balance, they have issues with that. Many of them have other chronic illnesses, and so they're taking more than 4 medications, and a lot of those medications have side effects, which includes drowsiness, dizziness, and confusion. They have difficulties also processing what they are perceiving. They have issues with depth perception, so that they can't tell when there's a step there, or they think that the table is actually closer to them when it's not. and they have difficulties communicating their concerns and fears. And we know that when people are afraid of falling, their risk of falling increases. So it's really important to keep these factors in mind and to take proactive steps to decrease your loved one's risk of falling. And you can do that by engaging in strength training exercises and help them use their walkers or their canes properly, and to help them learn the proper way of getting up and turning around and sitting down so that you are decreasing the risk of falls.
Let's take a tour of Betty's house. Betty is an elderly woman who lives alone in her older home. She has taken some steps to make her home more safe for her, but today we are going to find what other suggestions can be made to further improve her safety at home. As we look at the outside of Betty's house, some of the first concerns we notice are the sidewalk, the walkway, and the stairs going into her house. Let's take a closer look. The front walk overall looks good, but there are some concerns. The transition from sidewalk to walkway is uneven. We should be looking at the width of the walkway and the grade. Is the walkway wide enough for a walker? Is there an incline? Does water gather on the walk where ice might form? Now we look at the walkway from the driveway. It is narrow, and the step up is short and uneven. There may not be an easy fix for all of the problems that are identified, but at least we are making Betty aware of things to keep in mind when she is walking around outside her house. Betty tells us that she cut down bushes on the side of her stairs to open up the area. The walkway transitions into stairs, with steep rises and short landings. There are also no handrails or banisters. Ideally, there should be a handrail on both sides. However, if Betty only wanted to add one, the left side would be better, as that is the side the door opens on. Notice the concrete on these steps is cracked and breaking in some areas. Take a close look and make sure that there are no loose areas that could fall off or make for loose footing. We've made it to Betty's front door. Notice that there is no landing to stand on when opening the door, or enough area for a walker. This area could use a grab bar next to the door to hold on to. Betty also needs to be careful when opening this door as it swings outward. Inside the front door, we notice the throw rug is wrinkled, which could cause a fall. There is also clutter and papers blocking a clear path, creating a fire hazard. A grab bar inside the door might be nice for stability stepping in and out. The threshold should also be checked for stability. Notice the front door does not have a deadbolt. There's also a metal bracket sticking out from the door frame on the right. The doorbell should be checked to ensure that it is in working order. The volume should also be loud enough that Betty can hear the bell. The plastic throw rug should also be checked to make sure that no one slips on it and that it will not slide around. The rug in the entryway should be taped or secured to the floor. Note that the entryway is quite narrow. Welcome to Betty's living room. Like many people, her living room is cluttered and she has throw rugs. Notice that her phone is not cordless. This is good if the power goes out, but bad if she cannot reach the phone after a fall. Notice the plastic chair in front of the television? There are also piles of books on the floor, outlets that are full, cords near the radiator, and a space heater on the floor near furniture. Let's take a closer look to see what can be done to help Betty. She does have good sturdy furniture that she is able to get in and out of easily. Couches that people sink down into can cause problems when trying to get up. Boards can be placed under the cushions to help eliminate some of this problem. Betty's living room rug should be secured, or the edges should be taped to the floor to prevent tripping. Notice right in front of the chair there are books on the floor and a stool with a phone on it. These are concerning because of tripping hazards when she is using the chair. The book should be placed on a table or shelf, and the phone should either be put on the shelf or have the stool moved to the side of the chair. Loose cords are always a hazard. They should be tied up. Notice the cell phone charger on the shelf? These are great for people to have in their pockets when they don't have a cordless phone in the house. Again, there are loose wires. These are close to the radiator and space heater. The space heater should be in an open space. The cord should be checked for cracks, breaks, or frays, and the cord should always be laid out as to not be recoiled on itself. These cords can get hot and cause fires. Smoke detectors should be checked to make sure they are in good working order. Batteries should be changed twice a year, even if they are hardwired. There should be at least one smoke detector in each bedroom, in the kitchen, and one on each floor of the home. On Betty's stairs, there is more clutter, carpet runners, and a sheet in front of the stairs. Sheets can get in the way when trying to climb the stairs. They should be tied back if the person does not want to remove them. There's a light switch at the bottom of the stairs. There should also be one at the top. The railing should be checked for stability. Ideally, there should be one on both sides. The runners should also be checked to make sure that they are securely attached to the stairs to prevent slipping. Bare steps can also cause slipping hazards if a person is going up and down them with socks on. The clutter at the top of the stairs and the bookshelf should be addressed. These impinge on the space at the top of the stairs. Landings should be open and free of clutter. There is a phone on the floor with tangled wires around it and an overloaded outlet. Power bars with surge protectors are a great alternative to overloading the outlets. Twist ties and rubber bands can be used to tidy up cords. In the bedroom, there is very little space to move around. The height of the bed should be checked. Is it too high to get onto, or too low to get up from easily? Is there a phone in the bedroom? Is there a lamp or a light switch near the head of the bed? Any unnecessary furniture should be moved out to create more room to maneuver around in this area. Now we enter the bathroom. This bathroom appears to be well lit and large enough for a walker. Grab bars are present, and there's a good wide space to get into and out of the tub. The towel rack is sturdy and in a great place, close to the bathtub so there is no reaching. Betty has kept her tub free of clutter, and grab bars are a secure part of her tub. Here you see that Betty has modified a milk crate to make a seat for herself. This works well for her as she is short and unable to find a shower stool that fits her. Stools should be the right height for the person, and towels can be added to the seat to assist with comfort. Handheld showers are a great way for people to have control of the shower when sitting. Make sure the person can reach the shower head without having to stand on something. There are bars that can be installed to assist in lowering the shower head. This tub has grab bars already installed and shelves that are close at hand. There should also be a good non-slip surface in the bottom of the tub, as you see here. This handle is a great assistive device to help Betty get in and out of the tub. It also helps to block the narrow area between the tub and vanity where someone could easily fall and get stuck. Shower curtains instead of sliding glass doors help to open up the tub so it is easier to get in and out. The window above the tub is great for air movement, but caution should be taken if Betty cannot reach to open it. She should never stand on her shower seat to reach for anything. The toilet should be checked to make sure that it is the right height for Betty. There are raised toilet seats available if the seat is too low. Bath mats near toilets should have rubber backs or be taped down. There are no grab bars to assist with standing and sitting. There is also a lot of clutter on and around the toilet. Toilet should be free of clutter, and it should be easy for the person to sit down and get up. We've made it to the dining room. Dining room chairs should be sturdy. Make sure that Betty is not putting her air conditioner in by herself and that it is well secured to the window. In her kitchen, we find that there is a lot of clutter. Her coffee pot should be free of clutter, and make sure there is an automatic shutoff. GFI outlets are good to have in the kitchen. The back door of Betty's house has a tight area to exit. Doorways should never be blocked and should always be easy for the person to open and close. Grab bars would be helpful near this door. There's a nice big landing to step onto. The mat should be checked to make sure it is secure and will not slip. There's a good amount of lighting outside. The door is also placed so that it swings out towards the wall, which is good for maneuverability. These steps have no rails. Rails should be added to at least one side. When looking at the covered sitting area, there's an uneven floor that should be checked for stability. The uneven driveway is also a fall concern. Notice that there is another phone. If a person does not have a cordless phone, it is good to have phones nearby at all times. Betty does have a walker, but it is covered with clutter and is not easily accessible. Here's Betty's other walker. It appears to be unused. It does have tennis balls for easy sliding on the ground. Folding walkers are good for trips and to keep in the car. This is a picture of Betty's calendar. It has nice big numbers for easy reading. These and other visual assistive aids are great for people with poor vision. The Vermont Association of the Blind and Visually Impaired is a great resource for people. So now you have the tools to complete a basic home safety assessment. For more information, contact Community Health Improvement